Hi everyone. Welcome back to Speak English Basics. My name is Alex.
And I'm Emma. Today, we're going to learn some important vocabulary related to health and medicine.
Whether you're visiting a doctor, explaining a symptom, or talking about staying healthy, this vocabulary will help you feel confident.
Let's start by looking at some common health-related words. First, let's talk about some general words related to health.
Yes, let's start with these. Healthy, it means being in good health. For example, I eat vegetables to stay healthy. Unhealthy, this means not being in good health. For example, smoking is unhealthy.
Here are a few more. Doctor, a person who helps you when you are sick. Patient, a person who goes to the doctor for help.
And don't forget, hospital, a place where doctors and nurses take care of people. Clinic, a small medical center where you can see a doctor.
Great.
Now, let's talk about what happens when you're not feeling well.
Symptoms are signs that show you might be sick.
That's right. Here are some common symptoms. Fever, when your body temperature is higher than normal. Cough, when air comes out of your lungs quickly, often because you are sick. Example, I have a bad cough because of the cold weather. Headache, pain in your head. Example, I get a headache when I don't drink enough water.
Let's add a few more. Sore throat, pain in your throat usually when you swallow. Runny nose, when liquid comes out of your nose. Stomachache, pain in your stomach.
If you ever feel these symptoms, you should know how to explain them to a doctor.
Now, let's learn some words and phrases for visiting the doctor.
When you see a doctor, they might ask, "What's wrong? How do you feel?"
And you can reply, I don't feel well. I have a stomachache. I feel dizzy. This means your head feels like it's spinning.
The doctor might also check your body. They could say, "Let me take your temperature. I will check your blood pressure. You need some tests."
A test could be a blood test or an X-ray to see inside your body.
If you are sick, the doctor might give you medicine. Here are some common types of medicine. Pills or tablets, solid medicine you swallow with water. Syrup, liquid medicine, often for coughs. Injection, medicine given through a needle.
And here are some treatments. Bandage, used to cover a small wound. Cast, a hard covering for broken bones. Antibiotics, medicine that fights bacteria.
Remember, always follow the doctor's advice when taking medicine.
Let's talk about some common illnesses. Cold, a common virus that causes a runny nose and cough. Flu, similar to a cold but more serious with fever and body aches. Allergy, when your body reacts badly to something like dust or food.
And here are some serious illnesses. Diabetes, a condition where your body has trouble with sugar. Asthma, a condition that makes it hard to breathe.
If you have any of these, it's important to see a doctor regularly.
Now, let's talk about how to stay healthy. Exercise, moving your body to stay fit. For example, I exercise every day by walking. Diet, the food you eat. For example, a healthy diet includes fruits and vegetables. Sleep, resting at night. For example, you should sleep for 7 to 8 hours every night.
And don't forget, drink water. Stay hydrated by drinking 8 glasses of water daily. Wash your hands, this keeps germs away.
Small habits can make a big difference in your health.
What happens in an emergency?
You should call for help. In many countries, you can dial 911 or 112 for an ambulance.
Learn these words for emergencies. First aid, basic help given before a doctor arrives. Ambulance, a vehicle that takes sick people to the hospital. CPR, a way to help someone who has stopped breathing.
It's important to stay calm and act quickly in emergencies.
Let's practice with a short dialogue.
Imagine I'm the doctor and you're the patient.
Hello, doctor. I don't feel well.
I'm sorry to hear that. What are your symptoms?
I have a fever and a sore throat.
Let me take your temperature. It's 102 degrees Fahrenheit. You have a high fever.
What should I do?
I'll give you some medicine. Take these pills twice a day and drink plenty of water.
Practicing like this will help you feel confident when visiting a doctor.
That's all for today. We hope you learned a lot of useful words and phrases about health and medicine.
Remember to practice these words often, and don't forget to take care of your health. Remember to practice these words often, and don't forget to take care of your health.
See you next time. Bye.
Bye-bye.